Cerec's something that I would hate to try to live without because it's just become something that's so routine. I've done Cerec since 2006. It has just become such an integral part of my practice. When we start talking about doing a porcelain onlay, for example, I never think about, well, are we going to do that in one visit or two visits? It's in my mind, I know we're doing it in one visit, and you know, patients are really intrigued with the software and the high level of technology and everything. I don't know that many patients, at least in my office, know what the alternative would be, and that is to wait 3 weeks and go through the whole process of sending their restoration to a lab, and you know, it's one of those things where you, almost like a cell phone, you forget how cool it is because it's just what you're used to. But Cerec has just been great for us. From a certain point of view, we definitely are not a Cerec only office. I know there's some offices who that's all they'll do is Cerec restorations, and I'm not a believer in that. We do what is the most appropriate thing. In fact, most of the crowns that we do, we still do the old-fashioned way because I feel like from my point of view, the crowns that we get from our lab are maybe a little bit better crown than what we make on our Cerec, and so we do mostly inlays and onlays with our Cerec, but we do a lot of them, and you know, it takes away, sometimes if you were going to do a filling or an onlay and you knew you were going to have to send the onlay to the lab, then you might say, you know, that's going to be a huge pain, maybe we'll just do a filling, and you end up doing a filling and then that filling doesn't last very long, and then you have to do something else to fix it. So Cerec has just really stepped in to kind of fill that middle ground for us.